This is Agelust, a podcast where we walk fearlessly into the uninhibited years, merging desire and wisdom, venturing into new paths without regret. I'm Jessica, your host. I'm a board-certified nurse practitioner, and I'm also a menopause provider. Today's episode is about death. Just like sex, we can't avoid death. And besides sex, hormones, and mind expansion of medicine, or mind expansion as medicine, I love a good story. And in this conversation, we talk not only about what it's like to serve or care for people who are knowingly moving into that next transition, but what that means for us as loved ones, partners, children, and sometimes even parents. Let me tell you a little bit about my guest, Melissa Moreno, or formerly Doctor of Nursing Practice, Melissa Wentland Moreno. With 30 years of nursing experience and extensive training in hospice, palliative care, and urology nursing, Dr. Moreno is passionate about assisting patients and families at end of life. Her goal is to provide a roadmap for families to maximize the physical, emotional, and spiritual health during this tumultuous time, and she encourages the celebration of a life well lived. Quick word of warning, I usually use office inappropriate words. Also, while I am a medical professional, and in this episode I'll be speaking to another medical professional, nothing we say should be taken as advice or prescription. I am not your medical professional. So talk to your healthcare team before you make any changes. How you doing?
I'm doing well. I am currently in the process of writing an article for a magazine related to hospice. And I also work in urology. So I'm doing a lot of urology now in end-of-life care, which seems like it would be a simple thing, but there's a lot of patients who've had many advanced sort of urologic procedures, and nobody knows how to use devices, pumps, there's penile pumps, and there's implanted bladders and sort of all sorts of interesting stuff. So I keep getting calls to take care of their urological needs, even though they're on hospice.
Wow.
So I'm doing a little bit of everything that I've sort of crafted. And I'm also returning to school so that I can become a counselor.
Oh, that's amazing. Okay, so let me introduce who you are, Dr. Melissa Moreno. And you are a doctor of nursing practice, and your focus, how many years have you been working in hospice and palliative care?
Well, I was in hospice before I was a nurse. I was a spiritual care volunteer, and that was really just because I was a psych major and I wanted to do that.
Yeah.
But I worked in hospice ever since I was an LPN because people would ask, would you do hospice? Nobody wants to do this. And I said, sure, no problem. That was sort of the way I fell into it. And I never stopped doing it. I didn't do it full time, but I did it for the past 30 years.
Wow.
I've done it and I'm still doing it. And it's just getting better and better, actually. It's getting more and more interesting.
I imagine so. This is a super timely conversation for me. So the whole idea of Agelust is that it's how do we age? And because we're lucky if we get to age, right? And thinking positively about the journey of aging is so important because the alternative sucks. And so today is my mother's 84th birthday. And so many of us who are Gen X are finding ourselves in sandwiched between possibly launching kids or young children and older parents. I also have friends who are having partners who are struggling with their end of life. One more thing that comes up for me is this whole Jimmy Carter being on hospice. And now this has started a whole conversation. So you were one of my instructors when I was in grad school. And I thought, who better to talk about hospice care and end of life and kind of in the scope of our whole lives than you. So thank you so much for taking the time on this holiday day. It's February 19th to have this conversation. So 30 years, and you just made a comment that it's getting better, the work of hospice. Can you explain to people what is hospice care? What is palliative care? What your role is as a nurse practitioner or a doctor of nursing practice?
Palliative care is really providing care to anything that is end of life and end of is an end of life disease, life limiting disease. So if you get diagnosed with arthritis and we are not going to cure it, we're just going to manage it. That would be a palliative treatment plan. We're going to manage the disease as it progresses. We don't expect a cure. So It's a lifelong sort of modulation of disease that's not going to be cured in a palliative setting. That's a palliation. That means you'll never cure it, you'll learn to live with it, right? Now, cancers, which frequently used to be hospice or end of life terminal, have become more palliative domain where people are living with advanced cancers much longer than the terminal prognosis initially given to them. So the palliation of symptoms, patients could be hospice eligible in the past, may not actually be now. They may be more in that palliative care area where we're going to manage your symptoms until you get to a point where we don't have any more treatments that are effective. And then we will treat in this direction, which is a hospice focus of care, which is comfort care. So it's not giving up care for hospice, where hospice is the last 6 months or so. It is giving up the focus of treatment or goal-directed, disease-directed, some sort of management. When you stop that, you go to the hospice, which is more of a comfort-based focused. Meaning, right. What is the quality of your life? What kind of life do you want to live, knowing that your days are numbered? And how do you want to progress? And how do you want to end? And for everybody's afraid of dying. Everybody denies death in our culture. Culturally, we are not supporting each other with the fact that we are all going to die. And we know this because we find it very difficult to help people when someone that they love dies. And we see that because a lot of times we stop talking to people. We don't know what to say to them. We feel an angst internally, so we turn away from that person. And we don't generally mean that. We just feel uncomfortable and we haven't been given the tools to take care of those needs and help each other. In the past, I think religion provided a huge piece of that puzzle where your religious upbringing would help you manage and navigate through that system. So, people would sit Shiva for 7 days. People would go to a wake for 3 days. There was a process unfolding. And a lot of people find themselves less inclined to do those things in the same way as they've done in the past and uphold those traditions in the same way. So then we just need new traditions or we need a new discussion. But my feeling is that end of life should be as sacred as the beginning of life. Yes. And that's really what we should be looking at it as another journey, not something to be ignored or to be pushed aside or to not be discussed. It's another journey on this person's path and it affects every one of us. So that's pretty much the synopsis, the way I feel. My feeling is I never mention the word death or dying to my patients. They know where they are. They know what they're doing. I don't have to discuss it. It's not part of, how are you dying today? That's just not something we do. In fact, it's how are you living today? What can I do to
Mm.
help you be more comfortable? What are your goals? Has anything changed? Sometimes when I come in as the nurse practitioner, and I'm seeing the patient in hospice for the first time, I'm having a discussion of how do you want your medications to be managed? What things would you like? Do you want us to give you treatments that normally we wouldn't or we would avoid? But would you like those treatments if it came to this point in your treatment care plan? I ask questions that the family doesn't even want to discuss. And I also talk and I bridge the fact that once we're done taking care of the patient, we will also be reaching out to the family. And that is huge. I make sure that I say those words to the patient in front of the family if I can. I want the patient who is facing the end of their days to know that at the time we no longer take care of them, we will reach out to their family so that they'll be cared for. And it's positive in both directions. So the patient knows and the family knows to expect it.
Yeah.
I also try to do all of my end of life counseling with the family in the room in the sense that it's medical management counseling. So I'm saying we're going to give medication for pain or for difficulty breathing or for the things that are normal at end of life. You may or may not get them, but if you need them, how would you like me to treat those symptoms? Do you want to be more awake or do you want to be asleep if it's a cost, a burden, or a benefit to do so? Do you want to be more sedated or less sedated? I cannot put them under or give them enough medicine to, quote unquote, end their life. That's not my job. And we also make that clear because some people do ask for that. And it's not legal and it's not something I ethically feel is appropriate. Everybody has lessons to learn, even at the very end. And that's why I think I am finding the work more rewarding now because I'm seeing it from a different perspective. I'm growing into it,
Mm.
even. I guess I thought once you hit a certain magic age, you would have all the answers. And that was maybe my naive thinking as a young person. You know, I just thought that was the way it was. And I realized that you never stop learning. And I'm happy for that because I'm going to keep learning. But even at the very end, you never stop learning.
It's so I worked in hospice care for a brief time, and I only left because logistically things weren't working out, right? But it was some of the most rewarding work that I ever did. And I had already been a birth doula. So when I worked in a big, one of the only hospice hospitals in New York City, I found it to be so powerful to be there and be the witness of people's passing and also to support families. So, and the importance of talking about death and dying with my own family. So in my family, we do talk about it a lot. I talk about my mother's at the end of her life, right? She's 84 today. She's very vibrant, but she's surpassed, life expectancy of a Black woman, in New York City, in the United States. And how much time does she have? And I think, how do we start to, what are some things that we can do to help getting comfortable with talking about death and dying, or the fact that our life is finite? I know that you don't talk to folks who are, say like, okay, well, you're in hospice care and this is, our focus is shifting now. What are some ways?
I think you're very much thinking about that, the correct question. That is the correct question. It is not time in hospice to start talking about these things. But this is where we find ourselves, most people. Happy birthday to your mom.
Yeah.
And, you know, I think you guys having a discussion, open discussion about lots of different things in life and things, how things evolve, what your life is like, what your plans are, any regrets. I think having conversations that broach the end is important. You don't have to use the word death, because when you're gone, it's not as much important what happens unless you feel it is. But most people are like, oh, when I'm gone, I'm gone. But during the living process, you need to broach the subject of how do you want to live? They're going to start seeing people, like your mom probably sees people who've done things that they wouldn't want. But it's only through the experience of living that you start crafting your own. I don't want to use the word death plan because it sounds so morbid, but we have a birth plan when we have children, and we should have an equivalent to that. And I can't say death plan because it just sounds horrible, but maybe exit or a plan of transcendence. I don't know. I haven't thought of it, but I do think we do need to have a plan, and I think we need to have our own comfort level for that. And I think discussing things of how you want to live, like when you go to a nursing home or when you go see somebody who's sick, having a discussion around, if that were me, how would I feel? And being open about it to other people and seeing how they react. Some people will shut down and don't want to talk about it, and you have to respect that. I think respecting all parties at the end, when people are at the very end, some people just cannot handle it. They're not emotionally equipped to handle it. And people are very upset. Family dynamics become very concentrated, and they become very boiled down, and it becomes very intense. And then also there's amazing points of healing, and people do have wonderful healing moments with their families that wouldn't have happened. And those are little bits of what I would say magic. Those are the magic. I mean, outside of the random, beautiful things that just happen spontaneously, or these little bits, of people's lives that they suddenly have such joy and they're appreciating things they never appreciated before. That's where the learning comes in for the person. But in general, I think we do need to start talking about it. Every opportunity that we have, every change in life should be an opportunity to discuss how we would like our life to be if we were in that situation. And even though we're not talking death, we're talking change. And if you take Elizabeth Kubler-Ross, the way framework for death and dying is really the framework for every life change, a divorce, a move, any transition has a death and dying component to it. And I think we should look at that from that framework. How would we want to adapt in the future? That if you leave one job, you say, I don't want to have that type of job again. You refine your job search. Well, your life is very much in the same planning. If you don't reflect on what you're doing, you're sort of like repeating the same steps again. At least that's the way I see that. Your life patterns will continue to repeat. So if you keep pushing things off, you'll just push it off until the end. And eventually, everything will work itself out, but it may not be what you wanted,
Right.
So I think having conversations about these things are very important. My father just passed away 6 months ago, and he was very vocal. He knew he was going to die at age 31. He was told he wouldn't live till he was 50 because he had a disease that was unpredictable. And he lived until he was 78 because he was tough and stubborn, but he told us all how he wanted his last days to be. And the first few times he went to the hospital, maybe in the past 10 years, my brothers were just not interested in listening to his plan, even though he wrote it down, even though he told them specifically what it was, they weren't ready. And I had to pull every string I had to help them become ready, because if you're not ready this time, next time will be the time. I don't know when it is, but we had to have those discussions, and they just felt very upset about the thought of him refusing treatments that they felt were helpful. And in the end, when it was the time, I told them, this is it. He doesn't want to do this anymore. And they accepted it, but it took us a long time to get there as a family. My father knew when, but and within 48 hours, he was gone. So it was a very efficient passing, and it was most miraculous in many ways, and beautiful, because he was surrounded by love and he was sent out with love, which is nothing that anybody in a hospital can do. He was in a hospice facility, so I was blessed to have that support, but it was all the family that was around him. And within the next, within 10 minutes after his passing, we didn't let anybody in the room. I said, let's just take this moment as a celebration of his life with the people who love him around him. We don't have to let anybody know. Let's just, enjoy the moment, as odd
Yeah.
as it is.
Yeah.
Um, but yeah, so there's no rush to get somebody in here to pronounce him.
Yeah.
But
I, I,
it was beautiful, but it was sad, and it was all the things you don't escape grief, just because I've done this so long, it still hurts. But knowing that we'd followed his wishes makes it a lot easier to adjust to living life without him, because we gave him the end of his life in the way he wanted.
I think
And
that,
Charles could have stayed in the ICU, you know, for another week or two or a month, who knows? But he didn't want that. And I feel like that was a, a benefit. It was a blessing that everything worked out, and it was a benefit for him. Of course, he got to do it his way. Not everybody gets to do that. And yes, life is definitely not a guarantee that you're going to get to that age. You're not going to guarantee to get to whatever age today is. Tomorrow is a different day.
yeah. Yeah. I think one of the things that you said that's important is that, even though this is your work, right? You're surrounded, it doesn't, I think that people have a misconception that if you're in the medical field, right, and somebody is sick, death, dying, whatever it is, right, that you can separate yourself and compartmentalize it. And no, at that moment, you're the child,
Yeah.
you're the family. You like that is impossible to do. You're not there as the provider, and that we cannot avoid our feelings. And sometimes our feelings are anger, you know, uh, there are just so many extreme love, anger, you know, painful grief, and however that, and all the little components that come.
You were absolutely right. I mean, I am still processing trauma from 30 years ago, but I feel that I'm getting better. I think every day I'm getting better. And I think that it is a wonderful gift to get older. And I'm not going to complain, because it is what it is. I'm going to enjoy, and I'm going to try and squeeze the lemon as hard as I can. This life is meant to be lived.
Yeah.
So in that
Uh,
case, I want to enjoy my life. And I think that makes it richer, saying, I want my days to count. I just don't want to have them pass by and then realize, oh, I left my life behind because I was too busy focusing on other things. I don't think, I think we realize that too late in life frequently.
yeah. It's funny, the with my mother, and I'm so sorry about your dad. I lost my dad about 10 years ago. And it's, it's still, I'll have these deep moments or these deep periods of time where everything reminds me of him. It's like everything is a fucking sign from my dad. It's very bizarre. It's very
It
bizarre.
is. It is.
Um,
That actually, I mean, this is not the subject, we're being sort of in a left brain state, but that absolutely is true. Every sign that you see from your dad is a message.
yeah.
Don't ever doubt it. I cannot tell you that you should be doubting that. And there's also things that happen that almost feel like time stands still, or you
Mhm.
feel like you're puncturing time somehow, like you're immediately brought back to another point in time. Those little things, I had this one woman that I knew, she said she would find dimes whenever her husband would leave her something. She would ask her husband, who is in heaven, she would ask him for questions or guidance, and she'd start finding dimes. And she goes, I must be on the path because he's sending me dimes. And
Wow.
I said, if that's what you believe, absolutely take it and use it, run with it.
Yeah.
Because I do think there's mysterious ways that we live and we don't understand. Our spirits are so much better and more adept at teaching us things, but there's only physical things we can really do. We're not really focused on hearing that. There's things that happen at even in hospice at the end of life. There's beautiful things that happen that we don't understand. People see
Yeah.
people
Yes, I
even
remember that.
6 months before they die. I mean, there's really wonderful things that happen. It's just very, very intense,
It's very intense, and I
an
don't think that
intense
the
time.
yeah,
Lots of
the
intense things, but I do believe that people send, your family and your beloved ones send you gifts and signs that they're around, that they're seeing, they're witnessing.
yeah.
I just don't think we see them.
Yeah.
unless we're open to seeing them.
I think there's room to talk about that in this conversation because I've witnessed that myself. People will start talking to their family members or people, and then you'll say to the family, "Oh, she was mentioning Tom," and they'll say, "Oh, that's her brother. He died 7 years ago." And I said, "Well, she was talking to Tom as if he was in the room. He was literally in the room." And it, it's not like it's very unless you witness it, unless you are there and you're witnessing it, you could pass it off and be like, oh, they're hallucinating, they're this, they're that. No, these are real. It is very real conversations that are happening. It's
Yes.
amazing. It is
Yeah.
absolutely
Oh,
amazing.
yes, definitely. At the very, very end, usually within the last 6 months, people will start seeing things that are people appear to them, angels appear to them. Um, I've had one woman, an elderly woman, who told me how she saw an angel. And I said, "Why are you telling me about this angel?" And she said, "Because I know that you'll understand." And she didn't really know me well. I wasn't her family member, but she felt she could trust me with that. And I thought that was sweet. But I said, "I do believe you. What am I going to say?" And I was pretty young at the time. And of course, I was spiritual and, I was interested in those things. So it didn't surprise me. It didn't make me frightened. I think some people get frightened and shy away from it. But I do believe that those transactional sort of ways of communicating between different realms are happening. So I think the spiritual, I mean, they call it the veil, or they call it all different things. But I think there's Dr. Raymond Moody calls it terminal lucidity, when patients have this burst of energy and start doing things that are out of character and speaking to people or seeing things or seeing visions of people. Um, but I think it's even more interesting than that, because there are things that happen that occur with light, with bodies of light when a patient's dying. There are things I've seen, skin that glows,
Yeah.
that has no source of light. It's not jaundice. There's no medical reason. It's not the lighting in the room. And I've seen this peace and beatific presence that comes over people at the end. And I will say, I've seen enough people who have passed on, both in like an ER setting and, a trauma setting and in a hospice setting. And when someone passes in a way that's not kind or pleasant, it sort of remains on their face
Yeah.
after their
Yes.
passing.
Yes. Yes.
And that's a difficult thing to think of, that,
I I
I
think that
also feel that perhaps the spirit leaves the body before like the trauma happens, but I don't know that for sure. So that's speculative
yeah.
on my part. But I do know that magical things happen. I do know that mystical things happen. Whatever we call it, we haven't been able to scientifically prove that something happens, but people have said they've seen mists leave the body. Frequently, I see patients look over into the corner of a room and like smile or grab their hands up as if they're grabbing towards somebody.
Mm.
Um, Very, very, very often, there's a lot of patients who will talk about a train ride or buying a plane ticket or going upstairs when they only have one floor in their house, or going home. A lot of times they're saying they're going home, and we have the discussion with families when they're in a, a sort of a clinical setting. What do you think home means to the person now? Because
Mm.
sometimes the families think they just want to get them home, and they're really talking about something else, like, their spiritual home.
Yeah. Yeah.
And then,
Which
it's all a part of teasing out what's going on and where everybody's at and meeting people where they're at. You're always going to meet the family where they're at. You have no choice. The patient may be dying, but you're hoping to get the families closer to a point where they're accepting that, and it becomes a peaceful transition for everybody, because you you don't want you to think your loved one is going to go out feeling sense of worry or grief or tightness because you weren't ready. You
yes.
know, that's
Yes.
it's sort of like, I've had family members who said, if I knew we were going to get to this point anyway, I wouldn't have done everything that I did. in these last few weeks because I see it's futile. And I tell them that they don't have anything to be guilty of. They were doing the best with the information they were given. And there's no guilt or no shame that should be taken from that because here we are now at this new place and they should leave all that behind. One of the reasons I really, really love what I'm doing now is because I've been able to add another layer to my work, which has been a lot of visualization work and a lot of deep breathing exercises and things that help patients have a little ownership and a little bit more control of what's going on with them. A lot of times I'll do things before the nurse can give the medication. So maybe we'll be ordering a medication for their breathing and I'll say, can we do some exercises? Would you like to do that? And do some visualization. They'll say yes. And then the next thing I know, they're floating on an imaginary cloud or walking through a park or we're doing something that calms them down a little bit, gives them a little bit of peace. And I tell them, they can put their worries in a box and they can put a lid on the box and put the box aside just for a little while. They don't have to put any of those worries on their shoulders now. We're just going to take a little imaginary walk. And because they're so physically depleted, they don't always get to all the tasks, but they do tell me that it's helped them. So, I sort of also take that as a benefit, as another little thing that can be done to help somebody feel better about where they are at that moment and give them comfort, but in a different way. I find that medication is a tool that we always want to rely on in medicine. We're always trying to medicate things away, pain away, but you can't medicate spiritual pain with a pill. And the truth of it is we know that because we wouldn't have an opiate addiction. Psychological and spiritual pain cannot be medicated away. No matter how much we do it, it's only a temporary fix. And sometimes just having an open acknowledgement of their symptoms or their feelings or their worries and explaining to patients at the end of their life that it's very normal where they find themselves. A lot of people do find themselves feeling this way. It just deflates the balloon enough for them to ease up on themselves. And it gives room for a little acceptance.
I don't know.
That's important too.
Yeah, absolutely. I don't know if you know about this or what you know about it, but just talking about medication and talking about pain and kind of separating. So what about the use of psychedelics? Because I do know that there are a lot of people who work in hospice or, who do death doulas who support the use of psilocybin use, so magic mushrooms. And there's been some research on using magic mushrooms to deal with some of the taking the pressure off a little bit and making that transition easier.
I don't know enough about these psilocybin or any of these treatments at this point because we haven't used them where I am. We've used ketamine a lot for certain things. I've also been finding that, everything that is imbibed is only a placebo in a way. Everything has to come from the mind. Everything has to become when it's ready. Like I find that's you can just, it's the same thing as any other medicines. It can take some of the edge off, but it doesn't permanently change the problem or permanently change where the patient may see themselves. You hope that they have enough strength to get a spiritual awakening. That's really what it comes down to, because you're looking for the Kubler-Ross model of death. You're trying to get them to a place of acceptance where they start at denial and anger and bargaining, right? And they go through all the layers and they may go back and forth, but you're looking to get them to an acceptance point. But if anything takes away and provides some comfort, it's worth looking into.
Yeah, excellent.
So I'm not opposed to anything. I'm just always concerned about causing anxiety or causing paranoia or some people have negative experiences and you don't want that. And that's the, but that could be with any medication that you take, you can have a negative experience. So
Yeah.
it's fair game for all things you ingest or
When
take
you
in.
were talking about when you're talking about your counseling, like going back for counseling, is it is your motivation to go back for counseling? Obviously, I'm guessing it's going to be an extension of the work that you're already doing, but I think one of the things that's come up is trauma and past traumas for folks and kind of dealing with and reconciling with things that just didn't go the way that they expected, right? Or, you know, I don't know.
I don't think I'm going to be qualified to do the trauma work until I do the trauma work on myself.
Mm,
So I don't think I'd be going in that direction. I think I would stay with hospice and grief work. But there's so much need, though. There's just so much need for so much counseling. And I knew that before COVID, but since COVID, I see so many people are more unprepared emotionally for death than they were before. Like families are less intact, families are more divided. There's just so much either it's division by space, there's nobody in the area that lives close so that they're not close to them. So they're emotionally divided, even though they're genetically connected, but there's political and, situational divides that just have been created since that whole drama that we went through. Um, and I think, if anything can make people come together, it is a baby being born or a baby or someone who's leaving.
yeah.
We see that, good things and bad things do bring families together. And I'm not saying that's what we should be doing, but I think it's harder now. I think people have less, they think everybody should have shut down during COVID. They kept to themselves and they sort of divided, this is me and this is my people and those are your people. And I think people are less willing to share. They're a little more insulated and they're really showing the signs of stress
Mm,
when it comes to a devastating illness or a change. Because remember, not everybody on hospice comes to because they have a disease that they've been fighting for 15 years. Some people come because they had a car accident or they had a traumatic brain injury or they had a heart attack and they're not recovering. So some of these, problems are sudden. But, when you're insular and you don't have a lot of support, you're not going to live forever. Nobody is. It's just not going to happen. So having the ability to acknowledge that you need to reach out at some point for help is going to be very beneficial to everybody. But talking about trauma, everything is a trauma. And the way you view it, if you ignore it, the trauma festers
yeah.
and it seeps out somewhere else. So you're going to find it, you know, your family member may be an alcoholic and another family member used drugs and another one used sex and another one used food. And they're all fighting the same demons in their own way. So the traumas that they've experienced because they weren't worked on have festered. So those have to be worked on, but that's not for an end of life discussion. Where end of life is more like firefighters in crisis. So the
Mm,
nurses and the medical team are more like a firefighter. They're taking care of the immediate needs and getting them to a place where they can take a breath, literally, and have some meaningful contact with their beloved before they pass.
got it. Um, I don't want to take up too much more of your time, but I want to go back to the urology portion and that work. So one of the things that was really interesting to me, because probably you may remember that I have a very big focus on sexual health and sex and sexuality from grad school and that started way before I hit grad school. And at that hospice hospital, one of the things that they asked about was sexuality and sexual expression. And I thought, wow, how interesting, in a hospice environment to be asking about that. And your work in urology, how do you think that sex and sexuality, not necessarily, sexuality in terms of orientation, I'm just talking about expressions of sexuality. our sexual selves, how that plays into, or you see that in end of life care.
I think, I think, of course, in many ways, the things that were so important when we started growing into adults and has become part of our life for so long is still important. But I think in some ways, at the very, very end, we become more like children in the fact that we are less oriented to sexual natured things. I think it's more of a appreciation
Uh,
of life and sexuality, but not necessarily engagement. I don't think people are saying, I want to have sex every day. Some people do. I can't say that it's everybody, but it's a rarity more than anything else at the end. And it's discussed. It's discussed within families, it's discussed within counseling. Of course, it's discussed when the cancer is urologic. If there's a cancer or disease that's urologic, and we see that many times. So we know, and I have not really ever been shy about sexuality and discussing it with patients because of my urology training. I had to have the discussion about how do we handle navigating a changing sexual identity and a changing sexual outlet. So, you know, there's a lot of dark humor in hospice, so we could go there and talk about all sorts of interesting things. But we do find patients are asking or expressing frustration in the change of their sex life. But I always say that intimacy comes from the mind too. So having mental intimacy is probably more important than having sexual intimacy. And if you feel intimate with somebody, you can express that without having to use your sexual organs.
yes, yes.
I mean, it's not a perfect system and it's not a perfect way, and it's not what you remember having sex would be like. But a lot of women who suffer from GYN cancers who've gone through radiation lose their ability to have sexual intercourse unless their um, genital therapy is initiated early on during their treatments. And because radiation is so damaging to tissues, if they don't do that early before the tissue DNA actually changes, they will lose that opportunity to have sexual intercourse in a normal way for them. And I think that's important to not acknowledge. I think it takes a strong partner to be willing to try something different. But I think love shines through most patients. I see a lot of love. And while I may not ask them about their sexuality at every visit, it usually happens in the beginning when we're talking about intimacy and support and things of that nature. But then there's a lot of families that are also very different, and they may not have had a sexual relationship for a long time.
I think that death and dying is such an important conversation, not only as we get older and think about our own mortality, but the mortality of the people that we love. Hmm. And what is most important. Obviously, unfortunately, this got cut off. Damn it. It was such a good conversation. But how do we walk fearlessly? We can think about creating new jobs and being on social media and wearing something daring, or, approaching a partner, whatever that is. But how do we live fearlessly knowing that one day it will all be over? How do we live fearlessly knowing that we will become orphans if we're not already, that our children, we will leave them one day, and hopefully they will not leave you. We can get towards the end of life and we are still our whole selves, period. End of story. Be intimate with people, in all the different ways that we can be intimate.
Yes, you do not change. It's very, very rare that you change your personality at end of life.
Yeah.
So you don't, that doesn't change. So your needs, although they may change a little bit, they're still there. And your sense of humor is there and the personality that you have is there. It doesn't, you don't lose it. You may just have less difficulty accessing it, but people who know you see it.
Yeah. Yeah. I just want to end with some of the logistics. So one thing that people need to know is that you can be put on hospice, but it doesn't mean that you're going to die in 6 months. Sometimes people are on hospice for an extended period of time. Is that correct?
So, so thinking about President Carter
Yeah.
and thinking about his diagnosis and how he's hit a year on hospice for a cancer that is absolutely terminal, right? It's very rare that anybody lives past 5 years on this with this disease that he has, and he has a family history. But he has been on hospice for a year. It is likely that he has had declines throughout the year that continues to make him eligible. Hospice is a 6 month estimate. Remember, it's a medical estimate by two medical doctors. That's a national requirement that Medicare requires two doctors to make a decision about hospice, and that person is in the last 6 months of life. During hospice services, they continue to evaluate whether or not they're appropriate. There are patients, and I would say 25% of patients do come off hospice living and
Mm.
continue on because maybe they were, I like to call it a roller coaster, but they have a high and then they have a low. And sometimes when they're in the low, they look like they're terminal and they could be very close. And then they seem to, with the support and, getting their needs met, getting meds changed, helping them with their pain, they rise up again. They may never return to baseline, but they rise up enough that they're stable and they plateau and they come off hospice and they live longer, hopefully with some quality, and they always end up coming back on.
So I think
So,
that's an important distinction. I have to say, I'm surprised that Jimmy Carter is still around. I thought as soon as his wife died, like he was going to be like, I'm out, I'm done. But apparently his family says he's doing really well. So
well, I mean, he was put on hospice and still building houses. This man is like a gem. He is somebody who's going to be looked at on as somebody who really, walked the walk, and he really did what he said he
he
was going to do.
he did. I don't know, maybe he's just holding out to be like, I need to keep my energy here. So while this shit gets sorted out, because I think that, like I was saying to my father-in-law recently passed, and in December, and I was talking to my children about it, and I said, maybe he suffered from Alzheimer's for, oh my god, decades. And I felt like maybe he could do more good from the other side. Feel like he could be more of service to his family from the other side. I don't know. I don't know. That's
So I once asked a very wise nun that was our spiritual care volunteer and our spiritual care person. And she was a nurse, she was a nun, and she was an educator. And she's still with us. And, her name is Sister Maureen. But I asked her, why do people linger when they've done everything that they need to do in this life? It's just so difficult to watch. And she said to me, I've asked the question you're asking me to somebody smarter than myself, and they told me that that every person is here to learn something, to
mm,
do something, or to teach something. And sometimes you've learned your lesson and you've done all you can, but sometimes you're here to teach a lesson and you don't know who that lesson is for. So
mm,
there is some grace, and this life is still a blink of the eye. So whether it's a year or 5 years, it's a blink of God's time. This is infinite time, and we're talking about years. So if they're here to teach a lesson or they're part of some lesson, you don't know who the lesson is for until that lesson is completed. And sometimes it's teaching somebody patience, sometimes it's teaching somebody
mm,
compassion, sometimes it's the person who's coming in to learn how to take care of you. Maybe there's a bond that gets developed. I don't know. I think it's individualized, but it was such a good answer. It brought me such comfort
yeah.
because I felt like, oh, maybe there's still something more to do. And that sort of developed my philosophy that you're always learning, that you're always adapting, even at the very last day. Um, Now, sexually speaking, I always have to joke with my male cis patients who are just so sweet. And I say, oh my God, how did you get so lucky to have four beautiful women around your bedside? Isn't this what you always wanted in your whole entire life? And they'll get such a chuckle out of it, you know? But, you sort of say these things to make people feel good, you know?
Yeah.
I tend to make sure I look in somebody in their eyes and I say to them, oh, you have beautiful eyes. And they seem to sparkle a little more and they seem to resonate to that because everything else is falling apart, but the things that are innately you don't change.
Yeah. Yeah. And you can see who they are almost.
Oh,
Um,
absolutely. I can definitely see it. In fact, even when they're not talking or communicating at the end, I get a very strong sense of who they are. And I can almost tell the families who they are. Like, I sense that your father, your mother, your loved one is XYZ or is this type of person. They'll say yes. I could do that very, very comfortably.
yeah.
Um, I mean, I wouldn't call it, I don't define it what it is. I just know that it's something I'm able to do. And I'm able to communicate and say, if they had a wish, because I've had to struggle myself. If I could put myself in the bed, what would I want to know? What would
Mm.
I want to get at the end of my life? What would I want to receive from somebody who is caring for me? And the way I saw it is I want to know that I'm safe and I want to know that I'm loved.
Yeah.
And that is hugely important. And that was the impression that I would get. And so that's what I try to make sure I give.
Yeah.
At the end, you're safe and you're loved. If there's nothing else, and then I tell the family, we're going to keep them safe and we're going to give them comfort. But
Mm.
you are the ones to give him the true love. We can give love, but it's not the kind of love from an emotional space that a connection.
So it's such important work. I want to thank you for this time, and this is probably one of my most favorite conversations that I've had with people, folks on this podcast, um,
Well, thank you for
and
inviting me. This has been
yeah,
interesting and fun.
this is thank you so much. What last what last kind of thoughts would you like to leave people with, around death, dying, aging, or even
Well,
this idea of age lust, right? Of wanting more and wanting to learn more and wanting to live fearlessly.
I think the aging is a myth. We
Mm,
don't age mentally, we decline. We may become debilitated, but our spirits don't age. We're still the same human
mm,
incarnate spirit that we were when we started, and we do not feel any differently. When we're connected to that piece of us that is spirit, we don't feel different. I don't feel different from my 10-year-old self. My humanness has changed because I've learned and I've grown, but in the piece of me that hasn't changed is still going to be the same. I know it from now and I know it till the end. It's going to resonate the same. It's going to feel the same. I'm still learning and growing because this is my life and this is what I'm supposed to do here. So I don't want to stop doing that. I may not physically be able to do the things. I may need more support in the future. I have to acknowledge that. That's, my control issue, right? I have to learn to give that up a little bit as I get older. But every day that I can be strong, healthy, and wise, I'm going to try to be that better person. And
mm.
when it comes to a point where I can't, I've already told my family members what my wishes are. And
Yeah.
I'm very open to having those conversations with people. And it doesn't have to talk about the word death. I don't use it a lot. I just say if I ever get into a situation where I'm uncomfortable, if I ever get into this situation, I don't want those things. I have made sure that my verbalization's been clear. I've written my requests down. We write most and we do healthcare proxies, but so much changes in medicine 20 years later that they may not apply anymore. I feel like every person's journey is their own to choose. And if you want to choose that every resource be utilized, I am not going to fault you on that. I'm not going to criticize you or judge you on that. But I also know that I'm going to try and give you some peace wherever you find yourself.
Mm.
People frequently see different things differently at the end. So I am very happy to have lived such a great life. And I have my own miracles of my own birth that, that I'm here. I know I've been blessed since the day I was born. Not a
Mm,
doubt in my mind that I have been. And I'm lucky to be here. And I'm going to say I'm not going to waste it.
mm,
So that's what I would say to anybody else. Don't think tomorrow's coming. You're
mm.
only as young as you are today. So if we are ageless in one way, we are aging in another way. Enjoy your life. Enjoy the things that make you happy, and don't tread on people's hearts. Be kind when you can.
Yes. Well, thank you so much again. This has been amazing. Thanks so much for taking the time to listen to this. I hope that it's really sparked some ideas and given you hope. You can check the show notes for contact information if you'd like to email her, or you can just email hospicednp@gmail.com. As always, it means a lot if you follow, share, like, review, do all those things with the podcast. It lets people know that I'm out there, that we're out there, that we're talking about this. If you have ideas about people you'd like me to talk to or subjects you'd like me to tackle, please feel free to reach me through email at hello@agelust.co, that's C-O, or you can find me on the Instagram at agelust.co. Let me know what you think, and hopefully this gets you to talk about not only how you may want to be remembered and celebrated, but how you want to live and how you want to age lustfully.